Now we're just going to go ahead and explain a few of the complications, which is important that people understand. So in the best of hands with trained people and trained specialists, you will have complications. If you're poorly trained and inexperienced, not only will you have more complications, but you may not be able to deal with those complications, whereas a specialist can handle most of the complications presented to him. Now, the most common complication is porcelain chipping, where the tooth-colored restorative material chips off the metal core, which is traditional porcelain or metal crown on an implant. Sometimes the actual abutment can fracture. So this is a fracture 10 years after the implant was placed. Every time you chew, there's an opposing force on the implant. Teeth come together, the force transmits to the implant through the ceramic structure and into the implant screw and implant. Now, one of the things about implants is you get a much higher chip rate on ceramic crowns on implants, simply because the implant is rigid. There's no ligament, it's direct to bone, so the implant only moves about 5 microns, and that's the flexibility of the bone. So every time you chew down, there's a heavy impact to the crown. A tooth can move 50, 75, 100 microns, so it's like a shock absorber with the ligament around the tooth. But because the implant is direct to bone, no ligament, higher impact stress to the tooth, and the implant, much higher chipping rate. So you need better engineering on implant crowns. This is a common problem with all-in-4 style thing, where we have a laser welded teeth in a day. This is done in a day, and there's just a laser welded structure with some resin. 5 years later the resin pops off because it's very poorly supported. It was done in a hurry. Okay, now this is another problem that tends to happen over the long term, although occasionally it can be over the short term. That's implant fracture. Now in my practice, we've done 5,000 implants so far. I've had 4 implants fracture. 2 of I've restored, and 2 where people have put very large crowns on narrow diameter implants, and the implants had fractured at a later date. Now, this is an old case that was referred to me for treatment, and I removed this implant and retreated the patient, but there's a small cantilever bridge here, and after 20 years, every time the gentleman's chewed, there's a loading on the implant, and then you have metal fatigue and metal fracture. Normally the implant will fracture at the interface where it tapers, that's a stress point here, or it's more commonly where the end of the screw is, that's also a stress point, so that's the highest point of stress in the implant is about here. So they normally fracture there, leaving this bit comes loose with bone loss, and this bit is buried in the bone. Now, mini implants are commonly used by some novice practitioners. Although they're solid, they're only 1.9 to 2 millimeters in diameter, and they have a high fracture rate. Some of them fracture on insertion because they're just too thin. And again, it's just like a dressmaking pin, and you bend it with the load of the crown, and over time you get a fracture in the implant. Now this is a comparison between a mini implant and a 5 millimeter diameter implant. So just to give you an idea of strength, if this is a 3.75 millimeter diameter implant, if you increase that diameter to 4, you get a 40% increase in fracture strength. And if you go from 4 to 5, you get a 300% increase in fracture strength. So this implant is never going to fracture. Unfortunately, often the bigger implant, the downside is that you again have less bone around the implant. So then you have biologic complications where the tissue tends to thin and die back around this big fat implant. So putting a big implant or a large diameter implant has its advantages and disadvantages. If you have a lot of bone and a lot of tissue, that's great. It's, from an engineering point, it's fantastic. But if you're using up all the bone and actually very close to the surface, there is a risk that you'll have a biologic complication where the tissues die back. You then have exposed threads and plaque and accumulation, and you can risk losing bone and having a gum disease on the implant. Now, one of the most common complications with implant crowns, and this is usually by beginners, is where they'll cement a crown onto an implant. And in the process of pushing the crown deep into the tissues, they'll push cement deep into the tissues and deep around the implant. And then you get cement down here, and you can get significant bone loss around the implant and actually lose the implant. So this bone has been infected and lost, and this implant is irretrievable. We're too far down the implant. If it's fairly superficial, sometimes you can remove the cement, clean this up, and do a little bit of repair work and recover. But it's a problem when we do an implant, it goes off to an inexperienced practitioner. They then use a cement-on crown, cements into the tissues, and you can lose a tremendous amount of bone and have an irrecoverable situation. So these days, what we like to do is use screw removable crowns. In the old days, we were limited because the screw had to be axial to the implant, and sometimes you couldn't use a screw down crown. But these days, there are several companies now that have these angle screw change concepts, where the screw head can go around a corner, and the implant can be placed in one direction, but the screw can go in another. And then we can have a screw removable, repairable, retrievable one-piece crown, avoiding the cement risk.